Hi, my name's Ashley Griffin, and the title of my project was Determining the Feasibility of Offering Occupational Therapy Services to Pregnant Women on Bed Rest. For the first phase of my project, I did a literature review to determine the needs of pregnant women on bed rest and to evaluate what services they're already being provided, such as physical therapy or recreation therapy. And then I did a literature review to determine any unmet needs that these women may have and to explore how occupational therapy could meet these needs. In my first phase, I also interviewed pregnant women who had previously experienced bed rest to determine their experiences and any complications that they had experienced. I also interviewed a few physicians and nurses at a Nashville area hospital to get their opinions on what complications they've seen that women have had on bed rest and what services they're providing at their hospital. From my literature review, I determined that some of the women on bed rest are experiencing pregnancy complications such as deep vein thromboses or loss of mineral bone density or muscle atrophy, and that these complications aren't necessarily being addressed by most hospitals. So the next phase of my project, phase 2, was to develop a treatment protocol for pregnant women on bed rest through occupational therapy and to write a business plan for the logistics of the financial and operational plan of how OT could provide these services. In this phase, I found that it was feasible to provide OT services to pregnant women on bed rest. However, the payment process in most hospitals doesn't allow for a direct financial benefit for providing OT services on bed rest. However, I was exploring some possible indirect benefits such as decreased length of stay or decreased cost of care that may have a financial impact on the hospital. In my third phase, I presented my findings to a local Nashville area hospital, to many of their directors on the high-risk obstetrics unit for possible implementation, and I also submitted my findings for publication in OT Practice magazine and at AOTA conference, in 2014. So the findings of my project were that it's feasible and needed for us to offer OT services to pregnant women on bed rest, but that we would have to prove empirically that these services were beneficial to the women in order for the hospital to take on the financial responsibility of offering these services.